So I'm working with a patient who has muscle spasms as well as spinal stenosis. Some of the indications to treat a patient with traction are nerve impingement, herniated disc, narrowing of the intervertebral foramen. Some of the contraindications can be pregnancy, hypertension, can also acute sprains or injuries. Yeah. All right, Derek, how you doing today?
Good, how you doing?
I'm good, thanks. My name's Skylar Halford. I'll be your student physical therapist in the direction of Dr. Clausen. Today, I understand you have some issues in your lower back. What we want to do is we want to take off some stress that you're having in your lower back, and how we do that is we use this machine here. It's a traction machine. What it's going to do is it's going to kind of separate, not in a dangerous way, obviously, but separate those vertebrae in your back, because those nerves in there are kind of pinched right now.
Okay.
And we want to open that up a little bit so those nerves can relax, and then it should feel really good for you. Before we get started, though, I'd like to ask you a couple questions. First, have you had any surgeries in your lower back or in your back at all?
No.
No previous surgeries. Okay, awesome. You're a healthy individual. Are there any other fractures of any kind or other injuries to your discs that you've had in the past? I know you mentioned you had degenerative disc disease about 10 years ago, but anything other than that?
No, just that.
Okay, awesome. We'll get started. All right, so with our patient today, what we're going to be doing is intermittent traction. Because they have lumbar stenosis, we want to stimulate the mechanoreceptors and get a little stretch in the muscles there. And how I'm going to do that is I'm going to click on the traction idle button here, click lumbar, doing lumbar traction. We're also going to do a posterior approach so that we can open that up. Wrong button. Do that one more time. Progressive, because we're going to be doing intermittent here. We're going to take the patient's weight and divide it by 2, which would be 85. And then what we're going to be doing with this as well is we're going to adjust the time to, we'll go 20 minutes for intermittent, 20 to 30. Click that there. We'll take the patient through one full cycle, and then we will release the lock on the table after they've gone through one full cycle. That's it. Derek, so this is our traction table here. What I want you to do is kind of feel on your waist here. You can feel those hip bones you have. So when you lie down, just try and lie down kind of where you see this separation between these two straps here. Place that there as best you can. I'll also help to put these in the right spots. Are you okay then once you do get on the table for me to kind of place my hands here and make sure we're on the right place to stick those on with this strap?
Sounds good.
Okay, great. So yeah, if you just lie down. Perfect. So I'm gonna go ahead and feel those hip bones here. You okay with that?
Yep.
All right. So we're just gonna place this just below that spot right there. And it's gonna be pretty snug. Okay. So it'll feel really good at the end though. Feeling okay so far? Yep. Great. I'm just gonna tighten this up a little bit. You okay there? Okay, and then I'm gonna fill on your ribs here. We want to just place this just below your ribs. You okay with that?
Yeah.
Pretty snug, I know. Breathing
That's
all
good.
right? You
Yep.
okay? And then also what we're gonna do is we want to help separate, like I was saying, those vertebrae in the proper way to get that relief in those nerves. We want to lift your legs up just a little bit here. And I'll do that in just a second. Actually, I'm gonna hook this up first. Right on this little metal table here. Okay, perfect. Now go ahead, yep. Bring those up. Perfect. How do you feel? Do you feel comfortable there?
Mm-hmm.
Okay, great. I'm just going to attach this right here. All right, we've got our parameters set. So you're going to be feeling what's going to happen as the table at first, we're going to leave it right here, and I'll start it, and you're going to start to feel that pull a little bit. Okay, and if at any point that's too much, or it hurts, and you feel any sensation like numbness, tingling going down your leg or anything like that, just go ahead and hit that switch, and that'll turn the machine off automatically. Otherwise, you'll just feel that pull, and it will hold it there for a while. It's going to kind of go gradually up, and then it will come back down, and it'll take you through those cycles.
Cool.
All right. Okay, so I'll go ahead and start this here. Okay, so we'll take you through one cycle, and with the table locked, you let me know if at any point it's discomforting, but it should feel pretty good. All right, we went through a cycle, and now we're gonna unload the table. So I'm gonna come back here in just a minute. I'll hand you this belt right here. If you need anything, feel free to just take it on the belt. Exactly, you know what to do.
Okay.
And I'll be right back. How's it coming?
It's going great.
Been
Feels good.
Okay, we'll be back in about 5 minutes to finish the treatment. All right.
Oh,
So, how was that for you?
that's lovely.
It was lovely. No pain. Okay,
Nope.
good. Awesome. All right, well, we're going to shut this down here. And then what I'm going to have you do when we're done here, I want you to just stay here and lay down, because we want those, we don't want to get up and move too quick right after we've done this, because we have separated those vertebrae like we talked about. And I just want to let you rest and kind of let that settle in. And after a couple minutes, then you can hop up and
Okay.
get to it. Is that
Sounds
right?
good.
Okay. Take this from you. And I'll just remove these underneath. Okay. All right, so go ahead and hang out there for just a sec. We'll get with you in just a moment, all right?